as an enabling environment within Scottish Government to make these things happen. And we'll get into that a little bit throughout the process, but it's quite a large-scale piece of work, lots of learnings in there, and lots of evidence as well. And we're really quite excited about the potential for this work and this way of working. Particularly, as I was saying, we're very interested in policy design in particular, and that's what we're kind of talking about today. So let's get the acronym out the way. So GIRFE is getting it right for everyone. So this is I suppose a kind of a proposed framework, an adult practice model for young adulthood to end-of-life care. So you'll have heard of GIRFEC, and this is very much an approach that kind of covers anything that sits out with the scope of GIRFEC. And it's about organisations working together in different ways to provide social care support and services to people. The distinction isn't hugely helpful. It really aligns well with GIRFEC. But for us, it's a really interesting challenge because it's got a large scope, obviously, and it's a huge undertaking. And we're learning a lot from how GIRFEC was delivered and thinking about, well, what would we do differently to deliver this in a co-design way. The idea is it will form the future practice model of all health and social care professionals and shape the design and delivery of services. So making sure that people's needs are met. So there's a set of core principles within that. And that's really the kind of the Northern Star for the work that we're doing. And it's working with people to define what that looks like. And we'll talk a bit about how we're doing that, the approach we've taken to that, given the scale and the scope of that being so enormous. This is very much about how we work. And obviously, this is a set of priority areas and priority organisations that we're working with just now, because we can't do everything at the same time, but it's really about direction of travel. And for people, it's about how it's going to feel, it's a more personalised way for people to access help and support when it's needed. And it's about that really human rights-based approach. So it's about people at the centre, shared decision-making, and making sure there's a joined up and consistent approach, regardless of what stage you are in life. So again, a lot of those principles, fundamental principles, will not be new to anybody. That's certainly a way that we talk about public service reform. So again, a really exciting opportunity for us to explore that in this kind of very complex context. So why do we think we should co-design GIRFE? So I suppose first off, just to pick apart a little bit the terminology around co-design for us, and we talk about co-design, we talk about an equal partnership with people who are delivering services and people who are receiving services, and it's about people coming together to understand, so to work through that design process, so to understand the current situation, to make sense of that together, and to come up with solutions and put in place those solutions together. So it's a way of working, and it's integral to how we would want to shift kind of current process and the way that we deliver services and policy. And that's what we've been chipping away at for the last while since we've been in Scottish Government and beyond. So that's co-design. That's why we think we should be working in that way, and that's why co-design is a methodology. When we use co-design here, we know that's a journey for us. We're not under any illusion that we'll be able to co-design any of this stuff overnight, because it takes a long time to turn the tanker around, and I'm sure I'm preaching to the converted here. Working in these spaces, we have quite entrenched ways of working, and we talk a lot about system pressures, etc. And we're really keen to use this sort of methodology to help understand that and shift some of that. But we know that's a long game. That's not something that's going to happen overnight. And again, we're really proud of the work that's been done through this process and this programme of work, because it's starting to show how that might look and feel. So because we often talk about policies or frameworks or principles and kind of say this is how we think service and support should be delivered as per the principles that I just talked about in terms of what GIRFE is trying to achieve. But we're talking about what would that look like in practice? What are the practicalities around that? What would that look and feel like? Nobody disagrees with those principles and frameworks. And what we're trying to do with this is to make sure that we're working together to really understand insights and ideas from teams that are working in their communities and working with their staff and people who are delivering those services to understand those challenges, and then working together to help think about what that practice model would look like. So it's a blueprint, a way of working that means that we could apply that consistently across Scotland and we can continue to learn. So it's a real learning system beyond. It's not something that's going to be, again, at the end of this project, just that's it, done. This is something that is about how do we learn together and how do we put in place change together and how do we do that with a really evidence way, working together throughout. So we know that the nature of a design process means that we can do that, collect that insight, and start to connect that in to policy areas and make sure that, again, those system constraints that we often talk about, we can actually start to really think about those and do something about those, but equally start to understand what those enablers are going to be. We really don't want to be talking about the implementation gap anymore. We talk about that a lot in terms of the difference between the ambition and the actual delivery of services. And actually, we're trying to get into the nitty-gritty here around actually what do we need to change? What are the levers that need to be put in place? And how can we create a process to feed that evidence into that process and support people to make good decisions on that basis? So what we are saying here is what we definitely don't want to do is say, let's just do GIRFI because we've said it's a thing. What we're saying is we want to design GIRFI with the people it's going to affect, and it's going to and be an iterative process throughout. So our design brief is huge. As we said, this is a large scope. It's a huge project, and it's going to take a long time to kind of shift things. But the way that we see that is, how do we support the team that we're working with to understand what the practice model needs to be? How might we understand what organisations are going to need to implement that? And how might we ensure that those principles of GIRFI are going to be consistently rolled out? And that's across lots of different contexts. So there was a 5 different thematic areas that were kind of agreed at the start of the process that would be focus areas, so that we could start to look at different context and different areas of Scotland and start to bring a lot of that insight together and make sense of that together. So that was people in prison, receiving prison care, people in addiction services, older people in frailty, families with multiple and/or complex needs, including young people transitioning from GIRFEC. So what we're saying there is transitioning from child to adult services, and people registered in deep end GP practices. And for anyone who's not aware of that term, and it's not a great term, that's the GP practices in the highest areas of deprivation in Scotland. So there's 100 of them, and we have one health and social care partnership who's involved in this process, who's looking at that. So as we said, it's quite a large piece of work, and there's a lot of different kind of stakeholder groups and people are not involved in this. The 2 listed at the top of this are obviously the stars of the show. This is the health and social care partnership teams, who we call pathfinders or partners. The distinction between pathfinders and partners is simply that the pathfinders who have been with us for the 18 months, partners have come in at a later stage in the process. We started off the process thinking we would do the co-design of GIRFI with 5 health and social care partnership teams. We had a really incredible response to the applications process, and we took a lot more into the process. And again, there'll be reflections on that. I can feel Anna staring at me through the presentation just now, but we'll be reflecting a little bit on the size and scale of that and how we support such a large cohort. But actually the reflection being some people have joined the process and have added a lot to it. Some people have had to drop out at certain points due to capacity issues. We could never have foreseen those specific issues. Well, we knew capacity would be an issue, but we kind of have the number that have come in and out that have kind of changed, and we've learned a huge amount around what organisations will need in terms of support and how to manage a process like this going forward. So there's a lot to learn from that, and we would never have been able to say through that process where maturity sat across all of those health and social care partnerships until we started working with them. So we've got thoughts on how we might do this kind of work differently going forward. But again, the health and social care partnership teams who have done this work have been incredible. They have essentially, in terms of the co-design process, we have simply been supporting and creating the model to work through in terms of that co-design work. They've gone out and actually done the work. They've been out in their communities, taking the tools and methods that we've been working with them on and actually going out and doing that kind of wholesale engagement, which has generated so much insight, so much data. It's been absolutely incredible. So obviously, the staff and people who access the services have been working with those teams, and that data has come into us. And we'll talk a bit about how we've managed that process in a moment. But it's been quite incredible, actually, the amount of effort that's gone on. And a lot of this has been with significant resource challenges and constraints. There was no additional funding put into this process. This is because people know that the principles and ways of working that's been described as part of GIRFI is the right thing to do, and are really committed to putting in place something that's going to work going forward, and want to be involved in that change. So again, I don't think I can express my gratitude enough for those who've been a part of the process. Obviously, the Scottish Government GIRFI policy team, so as we said, we're really interested in how we kind of work as a collaborative, so we bring people together around this. So what we are trying to do is to support the policy team to think about how you use that evidence and insight that's coming in from this process to, again, influence different areas of Scottish Government. As we were talking about the scope, and the areas that we are focused on for the kind of the GIRFI co-design process, it's cross-cutting. It hits so many different policy areas. It's enormous. And so we really need that kind of connector within Scottish Government to help support influencing the change or the policy design that's needed to support or enable the change to happen. So there's a lot of work that's is happening at the moment and will happen beyond this, which is, again, taking all of that insight and making sure that that's well socialised and well understood, and actually people can come around that and do something with it. Obviously, the Office of the Chief Designer involved, that's us. There's a very small team, basically comprised of service design, user research, and content design. And that is to provide the support model to work with the teams that are involved in this, and to provide the tools and ways of working and the methods, and to support a lot of the analysis work around what's coming out of it as well. What we've been doing as part of this process is based on the design school model, which we talk about now and again, but it's basically the design school model is when we go in and work on big transformation programs like this, we are working through a full end-to-end design process, and what we're trying to do is provide support at every level of that to make sure that people who participate in design are well supported, to make sure that people who are leading design are well supported, and to make sure that our colleagues within organisations and policies who may be needing to act on that design work are well supported, and to provide a well facilitated, safe and inclusive space for people to come together to do that. The professional leads, they have been absolutely fundamental to this. So senior sponsorship is so important to making any change happen. And we've been really fortunate to have access to professional leads within Scottish Government, who are professionals who act as, who are specialists, who act as kind of professional advisors across different policy teams. And we've had access to Graham Ellis, who's the Deputy Chief Medical Officer, and Anne Armstrong, who's the Deputy Chief Nursing Officer, Carolyn MacDonald, who's the Deputy she's the health, let me just get this right, the Chief Allied Health Professions Officer. That's always a bit of a mouthful for me, I can never say that. And then we've got Joanna MacDonald, who's the Deputy Chief Social Work Officer. And that's just the kind of the four who've been kind of core to the process going forward. And it's really important to us that we had that cross-cutting working within Scottish Government, because we're really expecting that to be how people work externally as well. So bringing them together and them supporting that work and providing kind of subject matter expertise and leadership across the system has been so important. And we've had access to a network of all kinds of professional leads beyond that. So they've really provided support for us. And then obviously there's the policy contacts across Scotland as well. And as I said, we've been doing a bit of that policy mapping since all of the kind of work, and we've started to see all these connections emerging from really taking a person-centred approach. And there's a lot. So we will be continue to do that and to continue to try and bring people together across Scottish Government. But already there's been really good input in those kind of core areas so far. So it's there's a lot of moving parts to it. It's massively complex. But it feels the right way to work, to have all the right people kind of around the table, or otherwise, really working together on this stuff. So just very quickly, I'll just go through a couple of slides which just talks about what we have been doing as part of the co-design process. And this is what I was talking about in terms of that design school model. You'll all be very familiar with the double diamond, and that's how we framed a lot of this work. But what I would say is there's a lot of work in and around this, which is very much around supporting that kind of readiness piece internally, which comes in before you do the work, which is all that scoping and shaping. But really the bulk of the work is where there are what we think Pathfinders activities, so the Pathfinders and partners going out and working with people in their communities, and that's signified here as a green anchor point. And then there's the national sense making, which is where all of that information is coming together and everyone's working together to make sense and make decisions on what happens next. So it's a really collaborative process, but it's the data that's being generated by those Pathfinder and partner activities that's really important. And there's we've selected a range of different methods throughout that process, as you would expect to see as part of the design process. So how do we understand that problem? How do we define that down into something that we can take forward? How do you generate different ideas? And then going into a prioritization and a prototyping exercise before developing test plans and going out and doing that iterative update to it. So that's what's kind of itemized on this really complex diagram, but we are going to focus in specifically on the journey mapping piece today because that's the hot topic. So I've spoken about all the tools. I'm not going to go into them in detail, but we are today just going to focus in on the journey mapping. That has been a really important mechanism, and it was really eye-opening for us in terms of how that tool was used by the teams as they went out into their communities, and therefore the challenge that we had maybe in terms of making sense of so much information, so much data, and doing that in a way that was robust. So we've got a lot of reflections on that as well, but there was insights that came out of that process that we felt were really important, particularly around journey mapping becoming a kind of a tool that had a broader use than potentially the design work, but equally that it really helped people step out of what was essentially a very system or even service orientated view, and really allowed people to focus on people. But now that we're going to get to the good bit, because Anna's going to talk to us a bit about actual how we did the journey mapping and what that looked like for the teams in this process.
Thanks, Rachel. And I'm sure most of you know what journey maps are, but just in case you don't, or you've got a different perspective, I thought it'd be worth just grounding what we talk about when we talk about journey maps. So journey maps can help us build understanding from the perspective of the person, as Rachel has just mentioned. It helps us to also kind of analyze a service and look at it from different viewpoints and zoom in and out of a person's perspective. And journey mapping comes in kind of three different lenses, I suppose, or layers of fidelity. So the first is hypothetical. So it's based on assumptions. You might be mapping the current experience, but you may not actually be talking to someone who uses it or a staff member who provides it. And then the kind of next step up is kind of around that research mapping. So mapping that current experience, so that as is journey. And then another view on that is that kind of designed future experience. So what's the to be? How do you want it to look like in the future? And I think one of the key things for any types of journey mapping is planning is everything. You can't map what you don't know. And the reason why this was so helpful as a tool for the Gurfe work is that, and why we chose this method, is that it's a relatively easy tool to learn. And we had lots of opportunities to practice it, and I'll explain a bit more on that in a moment. And it's really quite easy for people to understand and have a conversation around. So people that experience or staff. So people that live busy lives have lots of other things in their minds. They can actually sit down and think about, oh, how might I talk someone through my experience? So it's a relatively easy tool for someone to engage with as well for a first time. And it's also really powerful. And I think this is what came out of all the work, was actually it was more powerful than we even imagined. So an example of that is we had, at the time when we did this piece of work, we had 8 Pathfinders working with us, and we ended up with 145 maps coming back. Now that was a massive amount of data, way more than we ever expected. And then equally, once that had been done, we heard from teams saying, oh, actually, we're going to use this to do another piece of work we're doing, or we want to map more because we don't feel like we've captured the whole picture yet. So I think that was kind of the real true power of this in the end, was actually people really got to grips with it and felt that it was going to aid lots of other work. So I think that was really beneficial. And then if we can move to the next slide, that'd be really helpful, Rachel. So what we have found when we're doing any kind of journey mapping and kind of coaching people on how to use this, because we've been on quite an interesting journey of training and coaching when it comes to design in the Office of Chief Designer, probably the last 7-8 years. So we've been practicing how to tell people about this process for quite some time, and it's fair to say we're still learning. So the key things that we have found is give everyone an example. You need to be able to show people what you're trying to get them to get to, and then equally making them practice. It's really important. So this is the example we shared with them, and we kept it really simple, and I'll go through the kind of layers of it in a second. But although we shared this example as something to get to, we actually rolled it right back, and we got everyone who was joining us to do this work from the Pathfinders to think about toast and map their experience of making toast in the morning. Now, some people had made toast, which is great. That's your as-is current experience of a journey. Some people hadn't made toast in years, and that was that hypothetical version of that journey. And it was just really interesting to then have people feedback on their experience of mapping making toast for breakfast. And what's amazing is people make toast in lots of different ways. I had no idea how many different ways you can make toast. It is fantastic. But equally, it was really helpful for people to understand the different levels of detail that they could share about their toast journey. And also when they reflected on that experience of making toast, they realized how much stuff they left out. And these are all really helpful things to learn, so that when you're having this conversation with someone who's a member of staff or people with experience talking about an experience, to make sure you ask more and you ask those why questions, and to take the time to really listen and delve down and understand the depth of it. So bearing that in mind, as we rolled it back, made it really simple, thought about toast initially as a way of coaching people through this experience, and then we reshared this example with them again. So if you move to the next slide, that'd be really helpful, Rachel. Thank you. And this is kind of what we define as being quite a simple journey map. So in all journey maps, you'll see you've got the passage of time at the top. Then you've kind of got what's happening, that next swim lane down. So usually we use imagery because that's helpful for people to connect. And then we've got kind of a little few sentences around this story underneath. And then underneath that, we've got what's working and what's not working so well from a GERFE perspective. And I think this was really helpful for the policy team, but also for the Pathfinders to start thinking about, okay, what does it actually mean to do GERFE? We've got these principles, but actually what does it mean? And then we also had a final layer specific to this project, which is around the principles themselves. And I think the reflection for some of the Pathfinders and for the policy team was a lot of people were ticking the boxes to say we're doing GERFE, when actually they were realizing that people's experiences weren't actually hitting the mark. So they weren't actually meeting what the needs of those people with lived experience were. So I think that was really helpful as a learning tool as well. So if you are using journey maps for the first time, I totally recommend that you think about what's the information you need to get from people, what's the conversation you need to have, what's going to really support your project, your work, your service going forward. And I think that can be really helpful for folks. And then if we go to the next slide, we basically just shared a blank template with the teams to go out and try it. And what was really interesting was, and we had a PDF version that people could type straight into. We had a printable version that they could scribble all over. And then what we found was, although we provided these different versions, people sent back even more elaborate versions than we had shared with them. So we had people who had created Excels with these really long journeys for people. Other people had put it into a Word document and in their table. So just being conscious that however you provide the template, people are going to use it in a different way, and that's okay. Is there anything you want to add before I talk a little bit more about the story so far, Rachel?
No, let's go for it. Oh, I went too far. Sorry.
So, as I mentioned, and Rachel's mentioned as well, so we had at this point 8 kind of Pathfinder teams working with us across 5 thematic areas. We'd done the design school training. We'd helped them prepare to do these engagement, ensuring that they were kind of in line with legal, ethical, and inclusive ways of working to ensure that people that were coming along to these sessions were going to be looked after well. As I also mentioned, we got 150 journey maps back from the Pathfinders, which was way more than we can imagine. So what we had then planned, because we knew we were going to get data back in and we needed to think about that national perspective, we had to make sense of it. So Rachel's already mentioned these national sense-making days that we've had continuously at points in the design process to bring everyone and all the data back together, was that we made sense of those maps, because we knew there was going to be so much data and so much to look at that in a day there's no way everyone could look through it. So the kind of design and the policy team got together in a room for about 2 weeks, I think it was in the end, to try and make sense of all that data so we could present it back to the teams and help them think about what's the next step. So how are we going to prioritize all this information, all this learning? And we used how might we statements as a tool to do that. So once we'd done that, we then kind of had the opportunity to send the partners out again with another set of tools around how to create ideas with people with experience and staff. And from that, they created kind of 300 ideas, which again is a vast number, which was then built on again by engaging with policy and professionals as well. So and then we kind of all came back together and had one of those collaborative sense-making moments, which was really helpful. So if we move on to the next slide. So we made sense of the data from all these journey maps in 3 ways. We looked at kind of national themes. So within each thematic area, what was happening, what we could see, what was happening for people with lived experience and staff. And then equally across all the themes, what was happening, what the big kind of things that were coming out of that. We also kind of developed system maps and system patterns. So system maps are when you look at the people and the system around them. So what are the connections? So if people are familiar with stakeholder maps, it looks a bit like that. And then a system pattern is thinking about, okay, what are the components of this experience for someone? And I think what was really helpful with that is you can start to see the dead ends. When you're looking at system patterns, you can start seeing where people are going through a continuous cycle of something. So we saw continuous loops of referrals for individuals. That's what kept on happening regularly. And equally with the system maps, what we found was that you basically use this tool to map out how information and communication and relationships work for an individual or around them. And what we saw in some cases, which is really painful to see, is that a lot of the conversations and decisions were happening without the individual involved who was experiencing the care, so or support. So I think these were really kind of telling ways of communicating back to the teams, this is what you've told us. And that's what we kind of took to those national sense-making days. So I think if you want to go through to the next slide, and this is kind of what it looked like. It was messy. There were lots of post-its, as you might imagine, and there was lots of process going on. So we, as you always do when you're making sense of lots of data, you cut it up in different ways and then you think about it from different perspectives. And in that larger kind of image in the top right-hand corner, you can see the kind of corners of those system patterns as they started to come through from the work that we were doing. Over to you, Rachel.
Thanks, Anna. I'm just going to very quickly run through just a couple of slides before I hand back to Anna, but it's just that point around how much data was generated through the journey mapping that teams did. We're still grappling with it, if I'm honest. You can see in that photo, it was a hot day. It was summer when we were doing that exercise. We're not leaving any of the stuff behind. We obviously had to take forward specific areas, but this Venn diagram kind of describes the kind of the very highest level of the theming that we did. So we had practical challenges, we had society, and we had system, and each of these bullets has got a whole load of information within them. So if you're talking about national themes, and then just wanted to show an example of how we're trying to define those insights so they can be used and reused going forward. What we really don't want to do is to go out and expect that level of engagement again without making sure we've made the most of the insights we've got. And I mean, insights are, we want people to use existing insights before they do any primary research. So this is again just an example of how we're trying to, I suppose, package this up as a national artifact that teams can use, they can come back to if there's areas they want to explore, what do we already know, and then you use that as a lead to move on to your next step. And we're really keen that across all of that work, this is the sort of format that we use and a common language around how we define these things. And the most important part in this table is the insight. insight. The insight is the call to action. It's the actionable point that people will take forward with the context behind it, and obviously a lot of detail around where did that come from and kind of get the raw data. So there's a process we're working away on the background to make sure this is a usable artifact going forward, can support future work. Anna.
Thanks, Rachel. So I've talked a little bit about the how might we statements that were created out of that national sense making of all that data from the journey maps. And this is basically an example of those kind of 9 how might we statements that were voted on and agreed on by the collective group, and then how they were then kind of split up across the different pathfinders that we were working with. And these kind of the split up of them are related who wanted to work on what, also who was working on particular path, kind of the thematic areas. And this is kind of what was the stepping stone to doing the next piece of work around ideation. And I think that's something that we were very conscious of when we were designing this piece of work, that was that each tool was a means to get to the next step, to do the next thing. So, and equally, if one of the tools wasn't working, we tweaked it. So an example of this was that we ended up with so much data. And I think if you go to the next slide, you can show this, Rachel, that'd be great. So with the ideation, we ended up with so much data. So bear in mind, this is 500 ideas, that actually we didn't have enough time on the sense-making days to make sense of it all. So we had to have more sense-making days after that point. And this kind of just shows a snapshot of all the information that we got. So again, before we got all the ideas in and we made sense of them, and themed them all in these areas. And then we gave this kind of massive long piece of wallpaper, the equivalent of, back to the Pathfinder days on the National Sense Making Day and said, okay, please have a look at this section. Do you think this is all themed in the right way? Do we need to move things around? And again, we had some fantastic feedback, which you can see has been built into this. So the green and the orange circles, that's highlighting where new data has been added in based on that sense making, and equally the boxes as well. So it was continuously iterative and learning about how to do this process the best we could, but equally how can we make sure that this process is meeting that kind of wider how might we's of how do we ensure that this model is implemented well, it's implemented consistently, and that we're taking people on this journey and doing it in a co-design led way. And this is just a highlight of the template of the, well, this is the timeline that we've been working to, but already all this stuff has shifted and moved. So originally we thought we'd finish this work back in March, I think it was, Rachel. And as you imagine, we're no longer in March. So what I think is really great about that, though, is it highlights the fact that we're moving at the pace that the Pathfinders and partners feel comfortable with, because this is a lot to ask these individuals to do on top of their day jobs, and they're doing an amazing, amazing job. As Rachel mentioned earlier, I'm flabbergasted by their attention to detail, their dedication to this work, and also kind of their open-mindedness to what they hear from staff and people's experience. And I think that's just, it's breathtaking. So total kudos to them. So we're now in that kind of last 3 blocks of work. We're in that kind of prototyping phase. So the Pathfinders and partners have prototypes. They're going out and they're testing for either the first or second time with people with experience and staff. So our final National Sense Making Days are next week on the 5th and 6th. So we're looking forward to having the teams share back with us everything they've learned about the prototypes, so we can understand, are these the right things? If not, how do we tweak them? Or is it actually time to put them in the bin and say, no, that's not going to work for what we're trying to do based on the insights we've learned back in kind of last year? And then also think about, okay, and how do we make this real? What are the outputs or outcomes, that we need to measure to make sure that this is driving positive change for people with experienced staff? And then what are the next things, what are the challenges to actually implementing this? What are the barriers? How can we support them with that piece of work next? So I think the final slide is kind of around reflections. And I think Rachel mentioned already about this, and she could tell I was making faces in the background. So it's fair to say we had more people than we expected to have join us on this journey. And we got way more data than we expected to have to deal with. And that was a tricky learning experience when it came to the National Sense Making Day, and it's fair to say we've still not quite got it right. So we heard on multiple occasions, you've given us too much data, we can't make sense of it, or you've not given us enough data, We want to see more. So this is definitely something, a really kind of critical balance piece that we're still learning about how to do. So we'll see how we get on next week, and I'm sure we'll learn even more from that as well. And then I think one of the other things which was very clear to us was that especially in the ideation phase, people with lived experience really struggle to imagine a future when they're experiencing challenges in the present. And I think is so easy to understand when you say it out loud, but actually as a design challenge, it's really tricky to get past. And I think something that the Pathfinders really struggled with was whenever they were engaging with people, that they wanted to start at the start, which makes sense. I want to tell you my story. I want to tell you what the challenges are before we start imagining what the future could look like. And it was just about making sure that there was space made for that to happen in those sessions, so that ensured that people felt listened to and understood, but equally that there were tools and techniques that the Pathfinders and partners had to kind of move them forward into that. Okay, so thank you for sharing your story. Now let's think about how can we imagine a future where this is different? How can we work to this goal together? So I think those are kind of some of the reflections that are worth sharing. Do you want to come in and share anything before we talk about those kind of big questions at the bottom of that slide, Rachel?
No, I'm just going to leave them hanging there, and then people can ask questions in around them. I mean, these are probably challenges that everyone experiences working in this sort of space. But for us, it's what do you do with, co-design doesn't exist in a vacuum. So what do you do with that insight, and how do you make sure that that's connected into the change that happens? How do we fill some of the gaps? We can't reach everyone. There's lots of different communities that we know that we're going to want to engage with as part of the next phase of work. And also that piece, when you looked at those insights, how do we make sure that we really are reusing and sharing and making the most out of that really resource intensive work that was done, and sharing it in a systematic way where it's useful for people? So these are the big questions that we're thinking about right now. But what I would say is this project has been an absolute eye-opener, and we're really excited about this as a way of working, and to continue to feed in that learning and those reflections as we go through and improve the model, and make decisions as we go forward. So I'm going to stop sharing so that we can see folk, and happy to answer questions.